Now, we'll quickly try to discuss another very important concept, and this is the concept of what? Systemic spread of infection. So when you say there's a systemic spread of infection, what do you actually mean by that sentence? Okay, so systemic spread of infection, So introduction, just so you know, if an infection is left untreated, or maybe it is treated but not properly, it can extend beyond that primary place where you have the infection, and it goes into the system, causing a lot of issues. So of course, when it goes into the system, it now becomes life-threatening. So it can spread through blood, okay, where the bacterial enters the bloodstream, okay. Now it can now go to distant organs. So it can cause a lot of sepsis. That's a body-wide inflammation. So lymphatic spread, this one when it goes into the lymphatic vessels, goes into the lymph node, then also systemic circulation. There could be direct extension where there's an infection just nearby to the place where there's an infection nearby to the place, they now spread to the place like that. So consequences of untreated infection is it could actually lead to sepsis and septic shock, okay, widespread inflammation, low body pressure, and organ failure. It could lead to a metastatic abscess. So you're having pus, and the pus is actually spreading, okay, to nearby compartments. Then it could lead to endocarditis, okay. So when it spreads to the heart valves, it could now cause, all those heart valve issues. So osteomyelitis, now it can also spread to bone, causing infections. It can spread to the meninges, okay, causing a lot of inflammation of the meninges. Then it can also cause failures of different organs. So risk factors for systemic spread is what? If your immune system is weak, it makes it now very easy for the infection to spread, okay, without any checks and balance. If you have diabetes mellitus, if you have poor circulation of blood, and if your treatment was delayed, or maybe they were treating you but it was actually inadequate.